Hi, everybody, and thanks so much for joining us today on The Beats with Dr. Mark Breiner. This is an incredible opportunity for you to really understand the difference between a biological dentist and a standard dentist and what that really means, some of the protocols that they go through. Dr. Breiner really explains the energetics behind vibrational testing and what that really looks like and why we might do that in a biological setting in a bioregulatory way. And what that means, you know, if you walk into a dental office and you have a toothache, how are they going to address that? That's different than a standard dentist. Or perhaps if you walk into a center like ours, why do we then, when you talk about your stomach pain or your shoulder pain, do we perhaps look in your mouth? And so these details are all going to be discussed today on The Beats with Dr. Mark Breiner, who is one of my mentors that I got a chance to meet just this last year. I've talked about his book for well over 20 years. He's just updated it. It's twice as thick. It's a very easy to read reference book called Whole-Body Dentistry to really exemplify that this is not about separating our mouth and our body. This truly is whole body dentistry. And so one of the things that I want to mention is he uses a great analogy as we talk about tile and gout. It's going to be my new analogy. So make sure you reach us right till the end. Share this if it does resonate with you. And share this with your friends, if you would, to make sure they understand the difference between biological dentistry and the things that they want to think about in regards to that. And Dr. Breiner's book is another avenue for you if you have more questions and you want to prepare yourself as you go through this journey to know the questions to ask so you can vet your own dentist and know the right alignment for you as you move forward. I'm so honored at The Beats here on Not Meds to be interviewing the greatest minds and greatest biologists and scientists from around the world. And Dr. Mark Breiner is no exception to that. So enjoy today's episode of The Beats with Dr. Mark Breiner, and we will see you at the end from our heart to yours. Welcome back to The Beats with Kelly Kennedy. And as you know, at Not Meds here at The Beats, we really talk about whole body dentistry. And to that end, I am so honored to have Dr. Mark Breiner, who's a biological dentist, here in our studio today because I've been talking about Dr. Mark Breiner's book, Whole-Body Dentistry, for 20 plus years since I got in this industry. And he's now upgraded his book. The upgraded version is available on Amazon. And how we met is funny because, you know, some of you know that I'm involved with Flowpresso and I'm very blessed to be a distributor of that. And I guess Dr. Breiner had heard about Flowpresso through the biological medicine speaker series. As of course, he's always continuing his education, even though he's been doing it for 40 years, he still keeps up with what's new. And he heard about Flowpresso and he just called the office. And when I heard that somebody bought a Flowpresso and they said it was Mark Breiner, I said, whoa, Dr. Mark Breiner? They were like, yeah. I'm like, Dr. Mark Breiner, the dentist from Connecticut? And they were like, yeah, why? Do you know him? I'm like, no, but I want to know him. And I don't often travel to go install Flowpressos because it takes 10 minutes. But I wanted to go meet Dr. Mark Breiner. I wanted to meet his staff. I wanted to make a better association with him. And I'm so pleased I did. He has an amazing center in Connecticut and his son runs the wellness side. He's a naturopath and they really bring the two worlds together. And for those of you who have been listening to the podcast or if you're brand new, please know that we know that you cannot heal the body if you're not ready to handle the blockades that cause the body to not go into the healing mode. And that healing mode, of course, is the parasympathetic. But what are those blockades? And we're going to talk about a big one of them today. And of course, Dr. Mark Breiner is not just a biological dentist, but he's really been a pioneer in our industry and recognized as such for well over 40 years as he's written his first copy of his book, which if those of you who are watching my video, it's a very dog-eared, sad looking book because we've used it so much. But now his gorgeous new book, which is hardbacked rather, is obviously twice the amount of information. If you're looking at the video, you can see he's really upgraded the information to make sure we got it all, because I'm sure he's learned throughout those years. But they're really good at identifying not only what the dental piece is, but how that is related to the rest of the body. And that is the point. And then he has the other side. I mean, they have hyperbaric chambers and they have a Flopresso, of course, and they have lots of different adjunct therapies to help the whole body wellness. So that's what we're talking about today on The Beats with none other Dr. Mark Breiner. Thank you so much for joining us today.
Oh, thank you for having me, Kelly.
So tell us, what's your 411 on biological dentistry? What is a biological dentist? Because even though they've listened to perhaps 35 or so episodes of this podcast, some people might not really know what that is. And I know there's a lot of caveats to that. So let's talk about that if you could.
Yeah, well, actually, that's a good question because not all dentists are created equal and not all biological dentists are created equal. So actually, dentists have different thoughts on what a biological dentist is. I mean, some dentists say, well, I remove mercury fillings, and they consider themselves a biological dentist. That's why I'd like to use the term whole body dentistry or whole body dentist, because that is far more encompassing. It takes into consideration the whole body and the implications that dentistry can have on the whole body, be it for the good or the bad. And it just entails a lot. It entails the physical part of dentistry and it entails the energetic aspect of dentistry. So a biological dentist is, one of the reasons I wrote the book is so people can educate themselves and know which questions to ask so they can determine for themselves if the dentist that's saying they're biological are truly biological.
Because there is it's an important distinction to make, because some people will call themselves a biological dentist and all they use is a dental dam, and that's the extent of it, versus high powered suction. And what are some of the things, some of the tools that you use at your center as from the biological dentistry side that really separate you from this? And we're going to talk about the whole body version in a minute and why that is so in alignment with what we're talking about, but just from the equipment side and the amount of the procedure of what, because we've never actually talked about it on that. What does it look like when somebody goes in to have their dental remediation done? Because so many of our clients go, oh, I'm just going to go to my standard dentist and do that. I'm like, no, wait, don't do that. Like, I would rather people keep them in their mouth than go to a standard dentist and have them drilled out. Would you agree with that?
Yes. I mean, unfortunately, I've seen people that have gone and had them out and now they're coming through because they're more ill than they were to begin with. First of all, before you get to the dental chair, what's very important is what are you doing to prepare that patient to have any fillings removed or addressing a root canal issue. So before we ever start doing that, I'm doing a thorough exam. We're using a 3D CAT scan where doing traditional dental exam, but I'm also doing very in-depth occlusal exam, the way the bite is. But the big thing I'm doing is energetic testing. So we're testing for really what's going on with this patient. And I find toxins are the biggest problem, not only just heavy metals, but chemicals, pesticides, all those sorts of things, mold. So we're checking for that and then actually asking the body, what's the order they want to go in? It's interesting that about 75-80% of the time, the body doesn't want to address the heavy metals first. They want to address other toxins. And we work on getting those out. And then when the body says, I want my metals out, that's when we address the metals in the mouth. But one of the most critical things is the mesenchyme, the tissue that surrounds every cell of the body, the interstitial tissue, you may call it. If you picture a tiled floor, if the tiles are the cells, the grout is the mesenchyme. And that's actually where the nerve endings, the venules, the capillaries, the lymphatics are all in that grout. And if that grout is blocked and you go to take fillings out of a patient, they can get very, very ill. So one of the things that's extremely important is to address that, make sure it's open. The Flopresso comes in very handy with that. You got to make sure that's open. And then when that's set, then we can go in and take out the fillings. And we're using what's called a rubber dam, which isolates the teeth. So I don't have things going down. We spray a powder inside the mouth that helps absorb mercury. We have high-speed suction. Suction kind of surrounds the tooth. So, and then we have, it's almost like a big vacuum cleaner, goes right in front of the mouth to suck out the mercury vapor, using a lot of water, using an electric handpiece, which is much more efficient in cutting out the fillings. And we section it. So we're not grinding and keep grinding and more vapor, because the dangerous part is the vapor that comes off. So we're using a lot of water, we're sectioning it, taking it out in chunks. Patient is on oxygen when we're doing it. And so we take those precautions. And then again, it's also what comes before, during, and then again after. What are we doing to detoxify that patient?
And when, sorry, my battery almost was going to die. It was plugged in, but you know, then the battery was going to die. Sorry, I was a little distracted there for a second, but I heard everything you said. So what's interesting, I think, for people to know is that what he said is key. He sections that filling instead of drilling it out. And so it comes out in chunks. And so there's less gas, because mercury is different levels of mercury. You have the substance, the physical substance, and you have the methyl mercury, which is more of the gas that's outgassed when you drink something hot, drink something cold, when it's touched, when it's rubbed, correct? And correct me where I'm wrong, Dr. Breiner, because this is your specialty, not mine. And I want to make sure that people understand, though, sectioning it prevents the most amount of gas outgassing of that as you can. But if there is, they've got this thing that sits in front of your face that's like this big vacuum that pulls that gas out, in addition to the powder that sits in the, is it a charcoal powder or carbon-based powder of some sort?
Yeah, it will use various things. Methionine we'll use, or charcoal. But the other thing is using a suction that actually surrounds the tooth, a high-speed suction. So it's taking it away. And the big vacuum cleaner is kind of like secondary.
And you're also protected with this process, correct?
We're wearing, my assistant and I are wearing a miner's mask.
Right.
That protects us from mercury.
Right.
And unfortunately, you know, dentists as a profession are the sickest. And that's because they don't take the precautions when they're removing mercury and they're placing it. And so they're the sickest of all the professions.
As well as the hygienists and all their staff and their assistants, because when they go in there and clean teeth and they're full of mercury amalgam fillings, that's also outgassing. But mercury amalgam fillings are not our only problem, are they, Dr. Breiner?
No. And it's not just mercury, it's heavy metals. Besides, the filling is half mercury, but the other half is copper, tin, zinc, and a little bit of silver thrown in, so they can say it's a silver filling. And
maybe a little nickel sometimes too, correct?
Not in the mercury fillings, no. But it will be in crowns. They'll put nickel into, if you have a metal-based crown, very often it'll have nickel in there, which is also a carcinogen and not the best thing.
So I love the analogy of the grout and the tile. That's awesome, because and I don't tile floors, but isn't there grout under the tile as well that it sits in?
It's under it. It's all around it. It's around every cell of your body.
That's so good. And I love his analogy, like the pathways, and we talk about it all the time, right? The pathways have to be open. So as that moves out, the streets are already moving. The traffic's already moving to make sure that nothing gets backed up. So that's awesome. We prepare before we go in. We make sure we're strong enough to go in. Then we make sure we have the right dentist to do it. That's going to take the proper precautions for them, their staff, as well as for us, obviously. And while we do that, now what is this energetic testing you do? Explain that if you would.
It's called EAV, electroacupuncture according to Voll. Some call it electrodermal screening. But essentially what we're doing is we're testing along acupuncture meridians, and we can find out where there are imbalances, and then what are the things that correct those imbalances. Dr. Voll was a German physician. He was an anatomy professor. He was a homeopath, and he was an acupuncturist and a surgeon. So I don't know, people that have seen the chart, every tooth is on an acupuncture meridian. It relates to different organs, tissues, vertebrae, muscle groups. So that there's a chart, and I'm sure a number of people that are watching have seen
We'll
that
put
chart.
that in our show notes. That's a great idea. We've never done that. Let's put, and actually we're going to put that right on our website.
Yeah, and that is almost 100% the 40 years of research Dr. Boll did. He started around 1950 and did research until he was around 1990 when he passed away. And that's really extremely important, is that connection, that energetic connection, how every tooth relates to different areas of the body. It's really, you have to be like I have in my book, I call them dental detective stories, because it's a different paradigm, and your whole approach, your whole thought process becomes a lot different when you have that as in the background.
And so what do you mean by that? So somebody calls the office and they go, okay, I've got a sore upper left molar, let's say. Okay. So how would you approach that? Why is it going to be different at a center like yours than it is at, Sally Joe's dentist office?
Well, you're going to do the same things traditionally. I mean, depends. You're going to analyze what's wrong. Is it sensitive, hot, cold, pressure, things like that. You may get an x-ray. You want to take a look. But the other thing is, a lot of times you sit there scratching your head and say, well, I don't really see what's going, I don't see anything on an x-ray. I don't see any decay. Why is this tooth hurting? Okay. Well, then you might say, well, maybe it's because it's on the meridian for the stomach. And ask the patient, do you have any stomach issues? And they say, oh yeah, I have GERD. And that leads you then into finding out and testing energetically, well, is the problem, because it's a two-way street, is the problem that the tooth is causing it, or is it that the associated organ is causing the problem with the tooth? So like in my book, I have the story of a patient who had terrible toothache, and it was the eye tooth, and couldn't see anything wrong with the tooth. But what it was on the gallbladder meridian, and she was having gallbladder problems. So a lot of dentists would have gone and done a root canal on that tooth because of the pain in that tooth. But really what it was giving her some herbs to help address the gallbladder issue, and then that took care of the pain in the tooth.
So can we unpack this two-way street for a second? And I just opened this book, and this is the dental chart of which we speak. Okay, so this is right in his book. So you'll own it and you can look at it. And as a biological investigator, of which I call myself, this is the most interesting chart. One of the most homotoxicology charts, pretty darn interesting as well. But this has been so clarifying for us throughout the years. So when clients call and they're like, oh, I have this, that, and the other thing going on, and nobody can figure it out. Typically what my next question is, so about 6 months before this occurred, did you go to a dentist by any chance and have anything done? And at this point, it doesn't blow my mind, because it's more like, what did you have done in the dentist for the last 6 months prior to this? I've stopped asking, did you by chance? Because 99% of the time they go, oh yeah, how'd you know that? And it makes you feel like really awesome at the same time as like, oh, I figured it out. But when patterns start getting created at some point, you go, you're not really that smart. You just see the same pattern over. But can we talk about what this means, this two-way street? Because this is key for people to understand how this actually works in the body.
Well, like I say, every tooth's on a meridian. So what's the health of that meridian? That can make the tooth, if it's your large intestine, let's say, and it's not healthy, the tooth can become more susceptible to decay. It can cause trouble with the tooth, but you could also have, let's say, a root canal on the tooth associated with the large intestine, and a root canal tooth gives off toxins, and so that can be causing a large intestine problem. So you want to be able to figure out which way is it going, and it's very important. Root canals themselves are a whole big issue and a whole big topic, and so sometimes it helps knowing that meridian. For instance, I had a young college girl come in. She had a root canal on her front tooth. Well, she was told to have that tooth out because, root canals can be trouble, and she was having some problems. Well, the thought of, and here's where I differ from a lot of biological dentists in the sense that I don't look at everything totally black and white, okay? Because let's say now that tooth, which is causing her some bladder problems, right? But the thought of getting that tooth out on this young lady could be more devastating than the root canal psychologically. Saying, I can't stand the thought of taking out this front tooth. I can't do it. So then what you do is you have to say, all right, we've got to deal with this. She's not going to take it out. Well, let's strengthen the meridian that the tooth is on. Let's make sure that that mesenchyme is healthy. Let's get all the other toxins out of the system. So our body is really just has to deal with this, mainly this one issue, and strengthen that meridian. And then we'll test the tooth and see, is it still a problem or is she tolerating it at this point? So
that is such a distinguishing key factor, Dr. Breiner. I really appreciate you bringing that up because nothing is black and white and everybody needs to be treated as the individual. And stress, emotional stress is 90% of all illness, right? And so it's really key to understand that. And I think like we had a client in here a couple of weeks ago, she had 7 root canals in her mouth and she'd worked for me previously. And so we were talking about everything that's going on in the world. And she's like, how can I best, like, should I go get them all out? And I said to her, that's just going to stress you out. No, I don't think you should do that. I think you should just like manage your immune system. You're tolerating these very well right now. You're conscious of them, but you're not overly conscious of them, and losing them all would make you more stressful. So we're just going to keep going. Your CRT is looking better. Things are looking better. Just keep going in that direction. And I think that's so key. Like, yes, do I think it would be a good plan to maybe do one a year for a little bit of time, perhaps, but not necessarily for a 24-year-old, like you say.
Yeah, it's, and let's say somebody has 7 root canals and we test energetically. Let's say at this point, 6 are testing well and 1 isn't. So take, testing energetically, you can kind of prioritize, and you can say, you know what, this one you should definitely get out. This is really bad. The other thing is, yes, the safest thing is you never have a root canal. Mm-hmm. But again, you have to take in all factors. And I'll never forget this fellow who wrote the book on cancer. His best friend, he had 12 or 14 root canals. I remember now. I mean, almost every tooth. He had every tooth crowned. He had this beautiful smile. He was about 75 years old. He was from Beverly Hills. I mean, he spent well over $100,000 on his mouth. And I have patients fill out an extensive health form. He didn't have anything checked off. And yet his friend is saying, you've got to get all those teeth out because they're root canals and root canals can cause cancer. You got to get them all out. If he were to take those teeth out psychologically after what he'd done, he was so proud of his smile and spent this fortune on it, that would have killed him. I really believe that. And he wasn't having any health problems and the teeth tested okay. So, in that instance, I couldn't say, yes, get these root canals out. I think that would have been more harmful than is having them.
But that might be a client that you have them support their lymphatics and the mesenchyme in a different way to make sure that that's keeping as clean as possible with that load that it's under to ensure that it continues to tolerate it.
Right. That's what you want to do. And periodically retest. That's key. And the big thing is that I don't tell the patients what to do. I educate the patients so they can make an informed decision. And then it's up to them which way they're going to go. What I think is really poor is, for instance, had a patient come in and she had an abscess on an upper molar. Now that molar is on the breast meridian. And so I said to her, does breast cancer run in your family? And it looked like I hit her between the eyes with a 2x4. She said, yes, my mother died of breast cancer and her mother died of breast cancer. So I explained to her the risks involved with the root canal, especially on that meridian, so she could make an informed decision. I think what's really terrible is you go and you just say, oh, you got to have a root canal to save that tooth. But the dentists aren't trained. They don't understand the possible negative implications of that. So really, I feel my job is to educate the patient. And that's one of the big reasons I wrote the book, is so they can make an informed decision. And then the decision is theirs.
And that's how we feel too about everything in life. Like, you got to be informed because you got to be your own advocate, and that there are options. I think that that's more than anything, people don't understand that. And, you know, I didn't come from a dental world. I didn't have really anything going on in my mouth when I got into all this. I had one little silver filling. And I remember when we first started talking to clients, caps, crowns, bridges, implants. I'm like, what the heck is all this language? And what are people talking about? What is a silver filling versus an amalgam filling versus a white filling? Like, I didn't even know what it was. And I think that there is very much this, like, oh, if I went to the dentist and they told me to do this, then I have to do it, versus realizing that there are options, whether that's no matter what the medical profession is, there's always a different approach. If you're looking for a different approach, there's one out there, and to be informed about what resonates with you, what feels good. And as long as it feels good, the body can tolerate it pretty well. Would you agree?
Yeah, no, everybody's different.
And let me tell you,
that's critical.
There are people skin crawling in biological medicine and dentistry with what we're saying right now, because they are very much a black and white situation. And I don't feel that the body works that way. And I love to hear that you don't either, because I think there's just all cavitations are bad and all root canals are bad and all, well, like, nothing's all good and nothing's all bad. Everything just is. There's no judgments. It's just what works, what's in alignment, what's regulating, what's compensating, what's not. And what's going to happen before it doesn't compensate? How can we prevent it to not compensate? Agreed? Right.
Agree with you 100%.
So
that's why some holistic dentists, you know, say I'm a heretic. So, you know, it's kind of like certain things get me upset. For instance, you mentioned cavitations. You know, cavitation is a hole in the bone, usually where a tooth was removed. Very often it'll be in the wisdom tooth area where it was taken out. Mm-hmm. And it's a hole, it never healed properly. It heals over, you can't see it if you look in the mouth, but it's a cesspool. It's a cesspool for bacteria, for viruses, for fungus, for heavy metals. It's just a cesspool. Now, the way many, many years ago we treat that, and the way most people are still treating, is you go in and you do surgery. You open it up, you go into the bone, you clean it out. Okay, that's great, except if you're not doing what you have to do beforehand, the reason they didn't heal in the first place is the reason they're not going to heal in the second place, or the third place, or the fourth place. I have people come in, they've had 2, 3, 4 cavitational surgeries, and they still have a cavitation. And so what you have to do is, again, you have to address that mesenchyme, you have to address all those underlying issues. And when you address those issues, and sometimes I use a lot of homeopathy, using homeopathy, sometimes just injecting into the area with some ozone, the body can heal itself. I haven't done a cavitational surgery in years. And does it mean I'll never do it? No, maybe at one point, the body won't heal it, and we'll go in and clean it out so it has less work to do, but we'll have done everything beforehand and it will heal.
And so energy, right? We're talking about energy, the infamous word that my husband said to me years ago when I said, how'd you make me better? And he goes, energy. So you're a medical professional. Explain energy to our audience, if you would, and what that means.
I don't know.
That's a great answer. I love it. Where energy
the body, the cells communicate, you know, via vibrations. It's all vibrational, and it's a matter of communicating, and that's how the cells communicate. That's when there is something that starts to go off. You know, when you're diagnosed, oh, you have cancer, that cancer didn't start the day before. It's been going on for a long time, and there was vibrationally, there was a change. And if it's not addressed, and this is why I love homeopathy so much, because if it's not addressed, it keeps snowballing until it reaches a point where there's tremendous miscommunication between the cells, and the vibrations are off. And that's, you know, that's, homeopathy is vibrational medicine. It's really what it is. And there are other, color therapy, music therapy, everything has its own frequency, its own vibration. And that's really what energy medicine is. It's dealing with these frequencies and vibrations.
And so many people are familiar with chiropractics, right? And I think about everything you said about the teeth, and I think about what people do know and are a bit more perhaps mainstream thought is, oh, if my vertebrae aren't in alignment, if there's a subluxation, no matter how extreme or in extreme it is, then the leads, the nervous system that leads out from each one of those vertebrae that then links to an organ might not work properly, correct?
Correct.
And so the teeth are the same situation, I think, a little more intensely personally, because I believe, and I'd love to know your take on this, that this is the end of every nerve, is your teeth, is a tooth. And it's the end of that real meridian, that nerve is right here, and it is in our mouth. And it relates to that organ system. And it's not just, when he says a meridian, it's not just, oh, this is my large intestine. It's the large intestine meridian, which pulls in 3 or 4 organs, not just one organ. And breast meridian, which is probably the most common meridian that we talk about in our world because various reasons, but the breast meridian crosses through your maxillary sinuses, down through your thyroid, down through the breast, down through the stomach, down through the pancreas, the ovaries, and the uterus. So it's a lot of those organs in the breast meridian, stomach meridian. So it's not just a breast meridian, it's not just a stomach meridian, it's a little bit of those. And then it's coupled with a small intestine meridian. And I don't want to get too deep into Chinese medicine here because it's not my specialty, yet it's become very aware that this, which teeth are your small intestine teeth? On the bottom and the top, correct?
Right. You have the molars on top,
yeah,
and the bicuspids on the bottom.
Are your
also, it can be your wisdom teeth, also small intestines.
So,
but you gotta understand like with the root canal, though, it's on a meridian, but it can affect anything in the body. The toxins, they're not confined to that meridian. So I just want to make that clear.
That's very, very good point. So even though I might have an issue in my stomach that's causing an issue for my tooth, or I might have an issue in my tooth that's causing an issue in my stomach, that same issue can also travel and cause an issue in my large intestine, even not even a paired organ, or in my kidneys. And that goes back to the more homotoxicology concept of biological divisions and all that, which we'll talk about on a subsequent podcast. But I think this is such a key point, that energy and vibration, this is how the body works. This is how the body communicates. As Dr. Breiner said, the cells communicate with vibration, and everything on the planet has its own unique vibration. And so when you walk into a center like his, they test all your meridians first. They want to make sure that your body's communicating properly before we ask it to do a bigger job. Whether that's a cavitational surgery, or perhaps we don't need to do cavitational surgery, we can do it energetically, we can do injections, and then get the body, the innate intelligence, to clean that up by removing the blockades, right?
Yes, the body is very intelligent. You know, one thing, like I say, homeopathy, which is my real love, and I study that all the time, and in reading cases, people are cured of cancer, they're cured of all these things. And you know what? They're not even addressing the mouth. So that, you know, always gives me pause that, yes, the mouth's important, but, you know, there's something even beyond that. And that's where the vibration, the energetics come in, that you can cure somebody with cancer even with a root canal. Now, so that leads me sometimes what I do with the patient, when we talk about the patient, oh, I can't get that tooth out. I can't stand the thought of that. I'll actually take a quartz crystal and put frequencies into that quartz crystal and put that in the root canal tooth. That will balance out the pore readings from the from the root canal. So now it'll test okay. I just look at everything in terms of frequency.
Because as somebody really brilliant, who was it that said, I think it was Tesla, if you want to understand the universe, first look at energy, vibration, and frequency.
Yes.
You have to. And so unpack, if you would, homeopathy, because we have so many clients that go, well, they put me on Nux vomica, right? One of the most like baseline homeopathies for digestion and gut issues, Nux vomica, nausea. And then they go home and they look it up and they go, oh my God, they gave me arsenic. Can you explain what a homeopathic is?
It's a frequency. That's what it is. It's, I mean, what's interesting, homeopathy is based on the principle like cures like. That substance, which when given to a healthy person will bring out symptoms, that same substance will take away the same symptoms in a sick person. And that's what you use. You use a homeopathic remedy to go and fix the ill frequencies. So essentially, you have books. It's very scientific because what we're called provings, right, where they gave these all, and a homeopathic remedy can be from plant, mineral, from anything really, can be derived from that. And what happens is they went and give this to healthy people and it will bring out symptoms in those that resonate with it. And they record that, and it's all recorded in books. And so the trick is somebody comes in with symptoms to match those symptoms which are present with a certain homeopathic. So if you give X to 20 healthy people and 15 of them come down with this, when somebody comes to you and says, Doc, I got this. So
he's twitching, for those who aren't watching it, he's got a twitch in his shoulder. He's just showing that. Go ahead.
Right. So X caused that in a healthy person. Then I know I'll give X to that sick person that has the same symptoms. And all that X is a frequency. And like I say, it's derived from animal, mineral, plant kingdom. It can even be derived from drugs. And what's really interesting is the way homeopathic traditionally is made is you are taking that substance and you, let's say, take 1 part into 9 parts of water and you succuss it, you bang it. And then you take 1 drop of that into another 9 parts and succuss it. And you keep going till you're beyond what's called Avogadro's number, where you don't have any physical substance present. And this is where they get the idea of allergy shots. So if you're allergic to pollen, they'll give you shots of pollen. But in Western medicine, even though it's tiny amounts, there's physical pollen in that shot. In homeopathy, or I would give you the homeopathic pollen, it would be the frequency of the pollen. And because it's a frequency, I make homeopathics not in a traditional way, but I make it in a unit I have where you're just putting a frequency into water.
This is a brilliant, again, distinction between allergy shots and low dose immunity, almost not even low dose immunity in other ways, but also homeopathy is that there's no molecular substance in a homeopath. It's purely the frequency signature that represents at a very diluted way so that it's way stronger. It's
right.
Smaller, so it's stronger. It's a weird math thing.
And if you resonate with it, it's going to work. Now, if you pick out the wrong one and you don't resonate with it, you just won't get the result, but it will do no harm. So that's first and foremost. You want to do no harm.
Do no harm. And I've used nothing but homeopathics we have on our child and nosode remedies, and he's pretty darn healthy at 8.5 years old. But he's never used medicine of any kind.
Right. Never and it doesn't mean that something may happen. There's a place for everything. God gave us everything. And If somebody had a massive infection, I say get an antibiotic, and we'll also treat it homeopathically, and we'll deal with the sequelae of the antibiotic and straighten that out after. But there's a place for everything. But the chronic use of drugs we have today. I mean, the average American I had read was on 11 prescription drugs. Nobody knows what the interactions are. They have no idea. You have no idea how many symptoms are because of the drugs. So the chronic use of drugs can usually be avoided using homeopathy or other forms of natural healing.
Of frequency, essentially.
Mm-hmm.
So what are some, and you've already told a couple of great stories, and we love your stories, you know, if you have, and not to put you on the spot, but do you have any like exemplary stories of how somebody came in, thought they had a huge dental issue, and then, you know, you worked on their frequency and their vibrations, and all of a sudden whatever dentistry was going on, whether you could see it or not, kind of cleared up, or cancer, or some other kind of illness? I mean, you've been in practice for so long, I would imagine you got a whole slew of them, but pick one of your best ones if you could.
Well, I guess a big one is the fact with the root canals and the cavitations. People coming in and say they were told to have all these teeth out and have cavitational surgery. And in the way we do it, in the way we start, and one thing I always ask patients, I say on a scale of 1 to 10, with 1 being you feel really terrible, and 10, you're feeling superific, mentally, physically, emotionally, you feel great. I ask them, what are you? What number pops into your head? And so a lot of patients say, oh, I'm a 2 or a 3 or a 4. Well, we're going to do, before we, like I said, when we start testing patients, before we do any dentistry, we start working on their mesenchyme, working on their toxins. We can get them pretty high up, 7, 8, without having to go and say, take out every root canal and address everything. So then it's, you know, patient doesn't have to go and now have a whole slew of teeth out, where now mastication is a problem, or they're into thousands and thousands of dollars for implant work. So it's those sorts of cases are the fun, and their patients feel great, and they say, you know, I feel great. I'm back at work. I can live my life, and they didn't have to go through huge amounts of dentistry, which unfortunately, a lot of times I see patients come in and they've gone through all that and they're still sick. And that's the biggest travesty, when they've gone through cavitational surgery, they've had root canals out, they've had their mercury fillings out, and they didn't improve.
Well, and again, I would postulate that's probably because of what you said earlier. It's the mesenchyme, right? It's the interstitial spaces. They tried to get rid of this, but it didn't go anywhere. And so it just, maybe it traveled a little bit farther down somewhere else in the body, but it didn't resolve because they couldn't drain out whatever that toxic load was, that burden.
Right. So that's, you know, that's the kind of story that I love to have a patient that were told to have, you know, $50,000 of treatment, or they had $50,000 worth of treatment and they still don't feel good. And you get them to a point where now they're doing very well.
Well, it's really amazing that for me, you know, part of the podcast is it's called From Our Heart to Yours, right? Because it's all about, when I started this journey 24 years ago, my husband said, go be in the other room and open your heart. Basically, I mean, he didn't say it in those exact words. He actually did say, go be in the other room. And I was like, well, what do you want me to do? And I was confused. It was the whole, like, who's on first, what's on second routine. And then throughout the years, I've come to terms with the fact that it's about opening my heart. It's about keeping myself safe and yet feeling vulnerable, and walking through life from an energetic perspective and feeling love all the time. And you're not 25, right? You're passionate. I mean, listen, I've been talking about your book for as long as I've been in the industry, for 20 years. And
thank you.
It's not a lot of people that continue to work beyond when they need to work, unless it's a passion of theirs. And it's so obvious from the minute you walk into your center, you can feel the heart. And literally every single employee that I met that day I mean, you have quite an amazing team of truly heart-centered therapists that truly care about patients and clients and truly wanting to get them better. And I would applaud you for that. And I would also like to know, though, on the other side of that is, what gets your heart warm outside of biological dentistry? Because what I know is that being happy in my life makes everything else go better, right? And I want people to understand that your heart is the key to real healing. And if you disagree that, please let me know why. And if you don't, let me know why, if you're willing to. And like, what warms your heart? What gets you going? Or is it just biological dentistry and helping people? Like, that could be the answer.
It's studying, reading. My family calls me Mark Reading. That's, as I told my wife, she said, oh, at some point we'll go off somewhere and maybe, we won't have the family all around. I said, all I need is you and my books. That's all I need. I just love to study. And that's my passion, is to learn and then to apply it and to help people. So people say, are you going to retire? I say, no. Why? I love what I'm doing. Why would I want to do that?
Right. And we appreciate it. And I would encourage anybody and everybody who wants to understand. I mean, his book is definitely more than just read it from front to cover. It's a reference guide. It's a continual reference guide. And it's why it's so dog-eared and been sitting in my office for 20 years, his previous copy and now his new copy, because things are going to come up for you, your family, whoever, and you want to know the real information about what that means and how that relates to the rest of your body, because our mouth is not separate and our energy isn't separate from our mouth. And it's one whole unit, whole body dentistry, properly named his book, to get people to understand that it's one body. And you got to work with it to learn what it's trying to tell you so that it can go back into alignment, so it can regulate and compensate for the internal and external stressors. And I think the most clarifying point that Dr. Breiner made today is that nothing is black and white. And even though you get all the details and information, you got to find the practitioner that's going to work with you, align with you, and work at the pace that your body wants to work at. So it doesn't cause you more trauma, more stress, and cause your body more illness. Even though you're trying to rid the body of toxins and burdens, you got to do it at the right pace and the right time. Anything else you want to say, Dr. Breiner?
Yeah, you know what? Beware of dental insurance.
Oh, yeah.
Yeah, I find, unfortunately, too much unnecessary dentistry being done because of dental insurance. So root canals are done very easily, because it's covered by insurance. You're going to have a crown on the tooth. I also don't like to do crowns. Those are caps on the teeth. I don't like to do that because when you mutilate that tooth, you increase the odds it'll need a root canal, but then the possible problems. So personally, I don't like dental insurance. I think it's better that the patient pay for it, go to somebody that's going to inform them so they can make a decision and not have unnecessary dentistry done. That's a little bit of a pet peeve of mine. I see too much unnecessary dentistry.
Well, I appreciate that. I think that's true in the medical system as well. When you have insurance, it's just what gets paid for and what not gets paid for. And I think that in 2021, when we record this podcast, now more than ever, if you're waiting for your dental or your medical insurance to pay for something, you're not on the right side of health, in all honesty. To really be in charge and have wellness, you got to be proactive, and you got to look for things that you can do to assure your health instead of insure your health, because insurance is about when things break down. Insurance isn't about preventative. And we've had so many clients come to me, oh, I can't handle my fillings, I don't have dental insurance. And I'm like, well, you might want to just call the dentist and see what it's going to cost you. Because I think people have a concept in their mind of what it's going to cost, and it seems unimaginable what it could possibly cost. And then when they get down to it, they're like, oh, that's totally affordable, I can do that. And I mean, I've never had dental insurance in my entire life. I paid for everything that I've ever done in my mouth. And I appreciate paying for my cleanings, because you know what? That makes sure I'm going to floss and I'm going to clean my teeth, and I'm going to use the right toothbrush when they do it, to make sure that when I go back, I don't have any additional fees that I have to pay to keep my mouth healthy and clean and well. to keep that microbiome just so. And I think that's a beautiful point you made about dental insurance, because I don't know what the premiums are, but I've heard clients complain about it, that I pay this high premium and yet it's not even covering as well the amalgam remediation or the dental remediation of whatever they're going to do. So it's the things you want to do, it won't cover. The things that you don't want to do, it's going to cover and kind of force your hand if you don't get informed and know better, right?
Right.
Be informed. That is really the baseline of this podcast. And we talked about this on a couple ago when we talked about the gene therapy, better known as the quote unquote vaccine, that we're not adamantly opposed to it. We just want you to be informed and know what you're getting yourself into, and don't get peer pressured by anybody, not by your medical professional, your medical dentist, whoever it is. Know what you're doing, be informed, and know what's going on in your body. It's your body.
Absolutely.
You're not your body, but it is your body. You're not even your mind, but it's your body and it's your mind. So take note of what's going on there, and we'll help you here at Not Meds in all the way that we can. And we really appreciate your time, Dr. Breiner, today. And for those that want to find Dr. Breiner, because I'm sure there's going to be a lot of people that want to find Dr. Breiner after today's episode, he's available in Connecticut. The website is wholebodydentistry.com, all spelled out WHOLE, Body Dentistry. And definitely get his book, which is available on Amazon. And it's available other places too, right? Not just Amazon. Like, where else can they buy it? Can they buy it right from your website?
No, Amazon's the best.
Okay.
That's the best way.
Not a big fan of Amazon. She tries to find other ways.
I know. It's unfortunate. They've just
no, I'm just kidding.
They've just taken over everything.
It is. But if you can find it anywhere else, get it anywhere else. And we'll make it available on our website, maybe. And maybe we can do that. And then I can just order a bunch of books and you can order it right here. So you don't have to go through Amazon. And it really does encompass both the physical and the energetic relationships in the paradigm of the whole body dentistry, which is the key to achieving greater well-being. So once again, we thank you for all the work, all your due diligence, and your ability to then translate into a very easy, readable, digestible format that allows people to understand how their body actually works and why it's whole body dentistry. And it's really to understand how their body actually does work.
Thank you, Kelly.
Thank you very much, Dr. Mark Breiner. And if you would like a Flowpresso, you can go to his office and get one of those as well. And we appreciate all your time today and everybody that's listening. If this resonates with you, please do share this with your friends. Make sure they understand the difference between biological dentistry and a real holistic, whole-minded dentist. That's not just going to do something because it's in a book, that he's going to take anybody that's really working in this field, really takes into account your individual, because you are an individual and you're amazing and you have the power to heal inside. And we just can help you figure that out when you find your naturally oriented therapists and medically enlightened doctors and specialists to be on your team to get your body to go into balance and to regulate, because that's what we want for everybody, to not feel of fear of what's going on, to have confidence and courage stepping through life with the amazing body that we have, that's constantly regenerating and constantly showing up to impress us with its innate, amazing ability to heal and recover. Thank you for this amazing body. Thank you for listening. And thank you all for sharing this episode of The Beats today.